In Malaysia, the HIV response has always been about people. The men, women, and families who face stigma, isolation, and fear. For 2 decades, global support gave them more than medicine. It gave them hope, a chance to be seen, and the strength to rebuild their lives.
Rather than having parallel programs that are funded internationally, we have been able to integrate and incorporate programs, but are led and the services are provided by the NGOs, working hand in hand with clinics, at the state level and of course at the federal level.
With global fund support, NGOs reached the streets, the clinics opened their doors wider, and communities at the margins finally had access to prevention, treatment, and dignity.
They have used Global Fund financing to largely finance prevention, community outreach, and community services for the HIV response.
These voices, once hidden, are now at the heart of Malaysia's response, and the journey ahead is about making sure no one is left behind.
I applaud Malaysia for being a leader in this area.
The numbers matter, but behind every statistic is a story like Ridwan's, a reminder of why this fight is worth it. Ridwan knows the struggle firsthand. Once a patient himself, today he is a community health worker in Kuala Lumpur. His mission, to turn his journey into hope for others.
I work as a community healthcare worker under PT Foundation. It's a partner Malaysian East Council and also Yayasan East Malaysia. So we are doing outreach for the key affected population to do the testing on the ground and then to bring our client to the clinic for further testing or any prevention method that we can give to our client. When you got the treatment, undetectable viral load, you don't transmit it to other people. We have the opportunity to have a family. But along the way, Alhamdulillah, after a few years, already stable on treatment, he already get his partner, get married and get a son already. I think already have two children. Yes, that's what very memorable for me lah. So what made me stay in this, because maybe I can help people to give some hope and to assist their resilient journey lah.
But not everyone's journey is easy.
I have a few clients that because when they have this experience, they are away from their family because their family do not know about their status. Then because they have shame, they're not going back to their family. I have some clients that involve something like using substance. After we have supported them and then they have them to listen, they get their life changes, going better, and then some of them, even though some of them go get a new job and then have stopped on their substance use, and then some of them even though go to Umrah.
For Ridwan, these moments, patients starting families, others finding the courage to reconnect with theirs, are symbols of hope, proof that Malaysia's HIV response is working.
Communities are the backbone of public health responses for non-communicable diseases, communicable diseases, including HIV, because they can deliver prevention, harm reduction and testing in the case of HIV, the treatment literacy and adherence support. They are able to reach the key populations that often find it hard to access mainstream systems or in some places are excluded. It also requires a rights-based approach and designing inclusive and collaborative dialogues to ensure nobody is left behind.
And that's where prevention, including PrEP, changes what's possible.
PrEP is a medication that effectively to prevent HIV up to 99% for if you taken daily.
PrEP, or pre-exposure prophylaxis, is changing lives. In Malaysia, its rollout began with global fund support, national leadership, and the work of community programs like Ridwan's.
With access to the Global Fund, we were able to implement more differentiated services to cater for other key populations. So that's number one. And number two, we were also able to scale nationally, which was always a struggle when it was purely domestic funding.
So from the perspective of the Global Fund, I mean, Malaysia was obviously responding to their own epidemic in their own time and way before the Global Fund came in as a partner. What the Global Fund has seen Malaysia do is a consistent, evidence-driven response since their very first days. They had a CCM before we had CCMs. They had a coordinated response across sectors from the very beginning, signed up for the Sustainability Development Goals when that was the goals that the global community had put together. And they've really partnered with the Global Fund since then to both respond to the changes in the epidemic, but also respond to the way the world has responded to these epidemics.
We already fund almost everything ourselves. That means like 95% of that our funding. So the transition will be smooth and natural. HIV prevalence among people who inject drugs has declined from 22% in 2009 to 7.5% in 2022. This success stems largely from publicly funded harm reductions program. Since 2003, we've been working with 20 NGOs through the Malaysian AIDS Council, and we have been spent 8 million yearly with strong accountability. It ensures support reach communities directly.
Ending HIV is not government's burden alone. Corporates are playing their part, making the transition sustainable. Yayasan Saim Darby is one of them. Their investments prove that HIV response is not just charity, but a shared responsibility.
Our support for MEF and MEC in the cause of HIV and AIDS, for prevention, treatment and care for HIV and AIDS is way past charity. It's not only charity, but it is our shared responsibility coming in together.
In Sarawak, commitment goes further. It's the first state to directly fund HIV programs. This tripartite effort, government, NGOs, and corporates, shows how local leadership strengthens national progress.
Sarawak is showing a real leadership. We applaud the Sarawak state government's foresight and willingness to take ownership of this issue. Sarawak faces unique challenge that require even a greater level of interventions. From vast geographical barriers to the cultural and linguistic diversities of its people.
In Sarawak, we are very fortunate that everyone come together from the Malaysian Aid Foundation, from Sarawak government, from Sunway Group and Tan Sri Jeffrey Chia, as well as Yayasan Saim Darby and Yayasan Petronas, as well as all the various NGO in the local area, and each playing their role, do their parts.
From Ridwan's patients rebuilding their lives to national leadership, corporate partners, and Sarawak's bold commitment, Malaysia's HIV response is no longer donor-driven. It is nationally owned, community-powered, and shared across society. Ending HIV by 2030 is possible. The story of Malaysia shows us how.